Sam Sherrington, bringing you some information about hip flexors and how they may be affecting your position in the saddle. Hip flexors are a big cause of not being able to get your leg down and on the horse, keeping your pelvis in a neutral tilt. If they're tight, you'll tend to have a forward tilt through your hips and your pelvis, and then an arch through your back. So if you're finding that you're getting the bum poking out and not able to actually get your leg down around the horse, get one leg down onto the horse properly versus the other, or sometimes both. If you're finding that you're always tilting forwards, you're always arching your back, your hip flexors are probably involved. To figure out which one exactly is involved, there's a range of tests. The main one that we'll be focusing on to begin with is your iliopsoas and your psoas. The exercises that we'll be covering will actually address your rectus femoris also, so we'll also discuss that. So to begin with, just to test whether you may have a problem, sit yourself on the end of your bed, something firmish. You don't want it to be, if you've got a very, very soft bed, you may be better off just doing this on the floor or finding another surface. Lay yourself back. What you want to do is bring your knee into flexion so that your lower back actually comes flat down onto the surface. So you don't want to be holding an arch. If you pop your hand underneath as you bring your knee to your chest and make sure that your spine is actually flat onto the surface, that'll make sure that you're actually holding your pelvis in a neutral or posterior tilt. That will give you the best information. Then let your leg drop down and see how far down it comes. You can see mine actually, my left one won't come down to the bench at all. Bring it back up again, swap sides, bring it down, and that one's actually a little bit better. What's actually happening though, you may have noticed, is as I brought this down, watch my lower back, I have a tendency to arch to compensate. So that's saying that my hip flexors are quite problematic. What you can also pay attention to is the position of your lower leg. So when you bring it down, if your knee straightens out, you probably have some tightness in the rectus femoris, in the front of the thigh, the main part of the quadricep. Same thing on this one. If you're finding that it's straightening this way, so there probably is a little bit of tightness in mine there, I can actually get it back and hanging down fairly reasonably though, so it's probably not a huge factor compared to the psoas and iliacus. What you can also do, and you probably will need a helper, is if you get yourself onto your tummy and bring your heel to your bottom, you should be able to get your heel fairly close to your bottom there. You will feel a little bit of a stretch, but that's a fairly normal stretch for the rectus femoris. So both sides there are fairly even, and I'm not feeling a huge amount of compensation. It's difficult because I'm trying to do it myself, but if you can get someone to push it to your bottom and make sure that your pelvis stays relatively stable rather than arching, that'll be a good one to test whether there's tightness coming down through your rectus femoris as well. So have a go with that, see what you find out, whether one side's tighter than the other, whether you're finding that you are getting a very positive Thomas test, as it's called. So if you're finding that your leg is up like so, and as you can see, there's quite a difference from one side to the other. That one I can actually, if I hold my pelvic tilt, that's as far as I can go without starting to arch. This side, holding pelvic tilt, I can actually get down a fair bit further without as much pressure on that tilt. So have a go with that, see what you find out, and we'll go from there with that bit of information.